This is the Veterinary Life Coach Podcast with Dr. Julie Capel, episode number 145. Hello, friends. Welcome to the Veterinary Life Coach Podcast. Today, I'm honored to host a serious discussion on infertility, miscarriage, and infant loss with some of the bravest women, I think, out there that have volunteered to be on this podcast with me. They're my very, very special guests, and I'm just going to briefly introduce each one of them, and then we'll get started in this discussion. First, I have Dr. Jessica Moore-Jones. She is the Director of Unleashed Coaching and Consulting, and she's been on the podcast with me a couple times before, and I've really enjoyed spending time with her. I also have Dr. Jessica Lindahl, and she is the Co-Chief of Staff at Apple Grove Veterinary Care. And I also have Dr. Lindsay Ruland. She's the owner and chief of medicine at Emergency Veterinary Hospital of Ann Arbor. So welcome all of you. I really appreciate you being here. And Jessica, or Jess from Australia, she's early in the morning and we're in the evening. So we're on a whole different day. But she told me when we got on this call that it's International Pregnancy and Infant Remembrance Day this week. So when we put this podcast out, it'll probably just have passed. So it's a really good discussion to have at this time. So I appreciate you all being here. I really do. I am
for facilitating.
Yeah.
I really think that it's something that more women than anyone cares to kind of think about in terms of sheer numbers go through something similar, if not the same. And the veterinary industry is full of our demographic, and I can't imagine that it's not something that's, you know, concerningly common and concerningly untalked about. So well done for wanting to talk about it.
Yeah, I really appreciate you being the one that kind of spurred this on and kind of had the idea that this might help some people. So do you want to start, Jess, and kind of tell us a little bit about your story, and then we'll go through and let everybody kind of share what they've been through?
Yeah, sure. So my story is probably on the unconventional side. I am 35 years old, and I decided at, my late 20s, very early 30s, that I was not having a great deal of luck finding the man of my dreams, and decided that I was going to make a plan that if he didn't come along in the near future, that children was something that I wanted no matter what, so that I was going to go down this journey by myself. So on my 34th birthday, that was the sort of process that I kicked off, and decided to, go see a fertility specialist, work out how to become what we would call a single mum by choice, and, use an anonymous sperm donor to get the one thing that I really wanted out of life, which is, a baby. And I had all of the tests. I went through everything, very thorough sort of fertility workup, all clear, perfect uterus, perfect AMH, which is kind of, the simplest, most common way of looking at your, quality of your remaining eggs. Everything came up great. Absolutely no reason to think that I wouldn't have success really early. I was well younger than most people who try IVF, because a lot of people don't get to IVF until they're having fertility troubles with a partner, or they're a lot older, or those sorts of things. So I was given a really good prognosis, and had 2 intrauterine inseminations, which were unsuccessful, which, isn't that unusual. They do have a much lower success rate. And then went through an IVF round and did manage to get pregnant on that round. And at 8 weeks had what we call a miscarriage, which is where the baby has passed away, but your body doesn't work that out. So it wasn't until I went for a scan, thinking everything was great, suffering all of the fun nausea and delightful things, that there was no heartbeat. But they make you do these unpleasant things like wait a week and recheck. So that's fun. And so then that was pretty devastating. After the tragedy of it, still needed to have a D&C, so effectively a termination surgery to go in and take baby out. And there was no known reason. We sent the embryo off for cytogenetic testing. Nothing wrong with baby, chromosomally normal, nothing wrong with me. So we tried again. And after a lot more drugs and a lot more needles and a lot more hormones, I got pregnant again successfully, and this time made it a week further. Had a scan where there was a heartbeat, but much slower than it should have been. So again, they make you come back a week later and you wait a week of knowing that the prognosis is really, really terrible. And you go back a week later and actually, no, the heartbeat's a little bit better now. Actually, it's growing, okay, we might be all right. So then you have a week of hope and maybe optimism. And then you go back a week later and then, there is still a heartbeat, but it hasn't really grown this week. So yeah, that miscarriage took 4 weeks before, again, another miscarriage, and that it passed away, but my body didn't know about it. Another D&C on my birthday, the same day my sister gave birth to my first niece.
No.
So I went from the hospital at one side of the city having a D&C to another hospital at the other side of the city to meet a newborn. And that's where I am now. So struggling a little bit, feeling pretty low a lot of the time, but ready to try again, because when you want something, you go for it, I guess, and you have to keep going for it so that you don't have any regrets. And that's the stage of life that I'm at the moment.
So what do you go through, Jess, during that week of waiting? Like, I can't even imagine.
It's insane. It's just this, you're miserable, but you want to believe, because I'm sure that I'm not the only vet out there that then, of course, reads every single scientific article that's ever been written about. I want statistics, I want answers, I want to know. And, I got to the point where when I went back for the future scans, I knew that as soon as the ultrasonographer said, heart rate of 120, I was like, oh, well, it's okay if it's 120, if it's over 6.5 millimeters, like I knew all of these things. And particularly with that second miscarriage, which took 4 different weeks of that really hell in limbo, I got to the point where by the time I finally had a scan where she'd passed away, I was pleased. And that is a horrible thing to say out loud and to admit to yourself, that you went into a scan hoping your baby is dead. Oh. Because it is better than the waiting to find out your baby is dead. And it's going to happen. And that, it's pretty much no longer compatible with life. So yeah, the guilt you then have to live with, that you walked into a scan wanting there not to be a heartbeat because it would be easier for this to be over now. There's nothing quite like it.
Yeah, just because of the waiting is so hard.
Mm-hmm. The waiting is absolutely the worst. And yet, you can look and go, there's a 90% chance that you're going to lose it, but you can convince yourself someone has to be that 10%. Why couldn't it be me?
Right.
Why can't I be that one person? Why, statistics has to work like that.
Right.
And so you can still hang on to this thread of hope. And I'm not going to lie, that's the dangerous part.
And the up and down, probably, like you're hopeful and then you're going through the statistics realistically, and it's like that roller coaster of emotion.
Yeah, for sure.
Oh, yeah.
And I think also, I feel like in our field, diagnostics may not say exactly what's going on with our patients. And so then we think, well, maybe those statistics are wrong.
Yeah.
Maybe they don't know what they're talking about. Yeah. And you want that to be the case.
Yes. It's very easy to let yourself find exceptions to the rule. And, I'm on a couple of single mum by choice Facebook groups, and, you make the probably mistake of posting, has anybody's baby been this size and had this heart rate and still gone on to be successful? And some people say yes, because that's how statistics works, is if you ask enough people,
you'll find the one.
You will get these positive anecdotes, and you cling to them because you believe that it could be you. And yeah, the roller coaster is by far the most upsetting part of it.
Yeah. So Lindsay, do you want to kind of tell us your story? Maybe I'll go through the stories and then we'll ask some more questions.
Yeah, sure. So my story's a little different. I was diagnosed with polycystic ovarian syndrome shortly after getting married. So I'm married to my high school sweetheart. So we were pretty young. I was 23 when we got married, and they told us right away that it'd be very difficult for us to have children without fertility medications. Surprisingly, we got pregnant with our first son pretty easily. No medications, no interventions. I was kind of surprised. And we had a lot of complications and early labor throughout the whole pregnancy. Before opening my emergency clinic, I've always been an emergency veterinarian. I worked at another emergency clinic prior. And I thought that the early labor was probably the long hours that I worked. Then we struggled to have our second son. Not too much in retrospect. I think we had our second son within 2 years after our first son. He had a lot of medical complications that diagnostics didn't pick up. He was born with a skull deformity that the ultrasounds never picked up. He had major skull reconstruction at the age of 6 months. He's a perfectly normal child now, but we had a lot of complications with that. And then after that, we really struggled. We had 8 miscarriages. Some were very early on, some were a little bit later in the first trimester. At that point, I was a practice owner. So you have to be the leader and you have to hide your emotions a lot. I think maybe by the second or third one, our doctor recommended a fertility specialist. We continued to have miscarriages at that clinic despite interventions, and they didn't really seem to investigate why it was happening. It was really disheartening.
Do you think maybe because you had 2 kids already, do you think they were like dismissing you because of that?
Mm-hmm. Yeah, very much. Also at that clinic, they were very heavily reliant on the nurses and the medical assistants that were doing the ultrasounds for follicle sizes. And any input that I would try to give was quickly dismissed by the nurses. And at that time, we were not doing IUI or IVF or anything like that, but we were doing different oral medications. And I kept saying, this isn't working. And obviously I'm getting pregnant, but then that it's not, something's wrong. I think we need to do some testing. They really dismissed it, wouldn't really talk to the doctor about it. By the time I spoke with the doctor about it, he dismissed it as well. It was really, really disheartening. So we ended up switching to a different fertility clinic, and she was amazing. Really personable, really sat down, wanted to go through every aspect of what our lifestyle was like. How did we get pregnant so quickly with our first son? What were the struggles with our second son? What were the issues, complications that we had with the first pregnancy and the second one, as well as why was our second son, why did he have a skull deformity? And she really wanted to do a lot of genetic testing, the kind of extensive testing that I'm sure Jess went through. And everything came back very normal. So they told us, right? Everything came back normal. In hindsight, they just had missed a couple of things on the blood work. So we actually got pregnant right away with our daughter through them. and that everybody was really happy and kind of shocked that it happened so quickly. We struggled with issues throughout the pregnancy. I had a strange antibody that showed up called an anti-Kel antibody. No one knew where it came from. I've never had a blood transfusion. I've only been with my husband, who's my high school sweetheart. Like, there's no reason why I should have had this anti-Kel antibody, but what they said is that it could kill her, could kill our daughter. So we were going through maternal fetal medicine specialists. They were monitoring her extensively. And then at some point they really kind of dismissed everything and said, you know, we think you're fine. We don't need to keep an eye on her. And I said, you know, I'm really concerned about this. Like, we've really struggled to get pregnant with her. We've prayed for a daughter for 10 years. We finally are pregnant with a little girl. And like, I'm not going to, with my history, like, why are you just going to dismiss this? We got pretty upset with them and ended up switching to a different hospital system.
How far were you along then with her?
I was about 6 months along when we transferred to a different hospital.
They were like, you're fine.
Yeah, it was very interesting. They said that with the anti-Kel antibody, she could become critically anemic and need intrauterine blood transfusions. And I had to my husband and I really had to twist their arm to do the typical process for that diagnostic process and monitoring process is to do weekly ultrasounds where you monitor some of the blood flow in the cerebral arteries. And so we had to really push them to do those weekly ultrasounds to monitor the blood flow through there. And they had some calculation they could do to figure out if she was anemic or not. I'm very glad that we had those ultrasounds because I got to see her every week. And so we switched. So I'm gonna cry.
It's fine.
We switched to another hospital system. They were much more personable. They were much more like, oh yes, let's look through everything. But also at the same time, they were relying on the other hospital system that's supposed to be one of the best in the world. And so I think they kind of thought you were seeing maternal fetal medicine at one of the best universities in the country, in the world. So maybe we don't need to look through everything they did and we'll just take their word. And they said everything would be fine. And 2 days before she died, I was a typical practice owner, taking on the burdens of all of my team because I cared so deeply for them that I didn't want them to be overworked. And instead I took the burden on and I was working 6 overnights a week at 9 months pregnant. Just not good. And 2 days before she passed away, I had this really awful feeling. I had only gained, I think, 12 or 16 pounds through the whole pregnancy. I didn't feel well. Something didn't seem right. I just had this really, I had this moment. I remember being in my bathroom. I had a headache. I remember being in my bathroom taking some Excedrin for my migraine and having this sudden, awful, dreadful feeling, like, and I collapsed to the floor just bawling. And I remember thinking, I'm just anxious because I just want her to be here. I'm just anxious. It's fine. And the next day we went to a doctor's appointment and they said, you know, you've lost 4 pounds since your last visit. And I said, you know, I really don't, something doesn't feel right. I'm really worried about her. I don't feel well, you know, and they took my blood pressure. They said, well, it's borderline, but it's not really, your blood work looks fine. You don't have protein in your urine, like everything's fine. They did an NST, a non-stress test. Her heart rate was way higher than it normally was. Her heart rate was normally in the 120s to 130s, and she was at 170. And my husband and I were both really worried. We were both really, really concerned. And they told us everything's fine. She's fine. You're fine. They didn't ultrasound her. They didn't do anything else. Sent us on our way. There was a cat at the clinic that needed surgery. It had a foreign body obstruction. So I went back to work and did surgery on a cat. The next day was supposed to be my first day of maternity leave. I was going to take a couple weeks off before she was here, you know, supposed to be here. It was actually a week before our C-section. And I was just going to take some time off beforehand, but I had a cat. I had been managing his case. He needed a toe amputation. Of course, anybody else could have done it. But here I go back in. And halfway through the amputation, I had this really severe abdominal pain and almost collapsed. And I almost ultrasounded her on my way out, and I'm really glad I didn't. Because I would have seen her dying. That just would have been awful. And I didn't feel well that whole night. They had told us everything was fine the day before, so I just went based off what they were saying, because it, like Jess was saying, you just want to believe them. You just want to believe that what they're saying. And I came home and I told my husband he could go to the bar with a friend and watch a football game and everything would be fine. I was having these really weird contractions. I just didn't feel right, and I knew in my heart, I knew. I just didn't.
You didn't want to
I don't
know.
want to go. I don't want to go in.
You didn't want to know.
No. So the next morning I realized she hadn't moved. And you know, as veterinarians, I don't know if you guys ultrasound, but I do ultrasound. I run an ultrasound service through our clinic too. I ultrasound things all the time. We got to triage the next morning. I just expected we were just going to deliver her that day. My 2 older boys were there, my in-laws. Everyone's all happy. And they put the heart rate monitor on. They can't find any movement, and immediately we knew something was wrong. And they bring the ultrasound in, and you know, you can see her aorta. I could see gas around her right away, so I knew. And then it's like, you never forget that image of the aorta with no blood flow in it, and the poor resident that had to tell us. I don't remember much after that, except I just was screaming, no, 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 and take her out now, do CPR. I mean, I was hysterical. They didn't really know why she had passed away. I had eaten that morning to try and get her to move. So they made me wait for a C-section. I don't remember how many hours, but it was a while. And then they delivered her and let me hold her. And awful, so awful. And they said afterwards, they didn't want to tell me right away, but they found a watermelon-sized blood clot in my uterus. I think they were all shocked that I was alive. Normally, with a placental abruption, they code the mom and the baby at the same time. But she was wedged in such a way that she saved my life. So we got to spend 3 days with her.
What's her name?
Her name's Olivia Rose.
I just want to know her name.
And there's this amazing invention called a cuddle cot, which I had just heard about a couple weeks earlier from another vet mom. And I'm so glad that I had heard about it beforehand, because I wasn't scared when they brought it in. And we got to spend 3 days with her. We had a lot of family and friends that came to visit. Our older boys got to hold her. We all took pictures. It seems, you know, if I had heard stories about it before, I would have been like, that's so odd to take a picture with your dead daughter. But we just adore those pictures now. So that was October 22nd of 2017. So her 3-year birthday is coming up. And it's really hard. I mean, she's absolutely a huge part of our lives still. Our boys talk about her, our whole family talks about her. It changed the way I practice medicine. She changed the way I lead my team. She changed everything for us. I thought about selling my clinic afterwards. I didn't want to be a veterinarian. I didn't want to go back to the place where she had died. But I couldn't do that, right? So I decided you have 2 paths you can take. You can either just curl up in the fetal position and just cry all day long, which is what I wanted to do. Or you can make something positive come from it. So we tell Olivia's story all the time. I know we have saved several babies, several moms who have experienced similar symptoms, and I urge them to go in, even though the nurses are saying, no, it's fine. And I just urge them to go in. And as I know, Olivia's story has saved babies, and that's all I can ask for. So that was us. After Olivia, we knew we still wanted to have kids. I had a vision when I was 5. I had a dream that I had twins. I had a dream when I was 5 that I had boy-girl twins. And that we knew we still wanted kids. After Olivia, we had a missed miscarriage at 10 weeks and had a DNC. And then after that, we got pregnant with our twins. I have 2.5-year-old boy-girl twins.
Wow.
They look exactly like they did in my dream.
That's
The
amazing.
strangest thing.
Yeah.
And you never take those things for granted again. That's for sure. It's changed how I lead my team.
How did you do during the pregnancy with the twins? Was that like terrifying? Were you scared every day?
Yes. Absolutely terrifying.
Anxiety is huge. I mean, I've
It was
only
terrifying.
I can't imagine. Like, I can't imagine how you go through the next pregnancy and just try to be okay.
You know, this is probably sounds odd, but the doctor who had originally said Olivia was fine, she showed up to our hospital room after she was born, hysterical, absolutely hysterical. She just kept saying, I'm sorry, I'm sorry, I'm sorry. And we handed out pink rose pins to all of the team that helped with her. And then we made the decision when we were pregnant with the twins that we were gonna go with the same team again. That they knew our case really well. That doctor was so honest and so compassionate with us, and so authentic that she could show up and admit that she was wrong.
That had to be so hard for her.
Right? How noble. I mean, she said she admitted she was wrong. She apologized. She said, I can never change it, but I can change it for the future, right? To save other babies. And so we decided to go with her, and she was super attentive.
Yeah.
Any little thing, we were in there. She was checking everything. That we went with the same maternal fetal medicine team. They were great. They were very attentive because they realized they had missed some things. I have some strange clotting disorder. No one knows the name of it. They just call it Syndrome X. I have an MTHFR mutation, so I cannot metabolize folic acid. And we didn't discover that until I pulled all my blood work. After Olivia died, I asked for all my records, located that abnormality. It turns out if you take high doses of folic acid, which is what they do in fertility treatments, if you have this mutation, you can't metabolize it. And high doses of, or high amounts of the metabolites or the folic acid floating around can create homocysteine, which leads to significant clotting abnormalities. And that was my issue. That was my issue, and no one knew it.
No one picked it up.
Yep. So we changed it with the twins. It was nerve-wracking. They almost died. I had a really bad feeling again. I had only gained about 16 pounds again with a twin pregnancy. I had gestational diabetes, which twin pregnancies get commonly. I said something wasn't right. I had a bad feeling, and my team immediately knew that that's how I felt before Olivia, and I was right. So they brought me in. My blood sugar was really low. They admitted me, and within 36 hours, their placentas both failed. By, I think over the weekend, my blood sugar was in the 30s. By Monday morning, their heart rates were not reactive on the NST. They delivered them, and we asked for the same team that delivered Olivia. we brought them all in. They had all been so involved with the twin pregnancy. It was such a joy to have them all there. And our girl twin, Sophia, looks exactly like Olivia. Looked exactly like her. The whole team gasped when they took her out. She looks just like her. Nate also looks like her, but he was in a lot of distress when he was born. And he's having some residual issues now from it. But yeah, it was quite an experience. I won't be having more kids because apparently I had a window in my uterus that was about that big. And they could see the twins through it. They said if I had bent over to put my socks on, they would have ruptured and all three of us would be gone. So that's my cue that can't do this anymore. But very long, difficult process for us. You know, when you get that far along and then someone makes a boo-boo.
Yeah.
It's devastating. So that's my story. It's my long story.
Imagine. Oh, well, congratulations on the twins. That's a blessing.
Yeah, they're a joy.
Well, and Olivia is a blessing as well.
Yes.
To other children,
every
right?
day.
So Jessica, do you want to tell us your struggle and your story?
Sure. Mine's yet a little bit different from you guys, but I took notes so I can try to remember. It's been a process, but basically my husband and I got married in 2013, and then we waited until about 2015 to start trying for a family. I got pregnant right away, and then right around like the 12 week mark, I had a miscarriage. I didn't have to have a DNC, but still obviously very traumatic to go through something like that when you're so excited. It happened so fast. You think everything is going to be fine because everyone else is fine. And so that happened, and basically just said that it happens really commonly. They didn't look into it too much at that point. And so we continued to keep trying through like 2016. Finally got pregnant again in like midway through 2017. And I miscarried again, probably around like the 6 to 7 week mark. So again, pretty early on. So that's when they started trying to look into things a little bit more. And they did find that I had a clotting disorder, antithrombin 3 deficiency. So they're pretty sure that's part of the reason why the miscarriages took place, since I'm pro-coagulatory, or like prone to throwing clots probably into my placental attachments. They never did any analyzing of the fetuses or anything like that. But so then basically just kind of went on aspirin and didn't really find a whole lot else to figure out why we were having so much trouble getting pregnant and staying pregnant. So we finally asked for some help through our OB and were referred to a fertility doctor in 2018. Had 3 rounds of like IUI late in the year, and none of those were successful. And then basically my husband ended up shattering his leg in a really bad accident, so things got put on hold for a minute along with like insurance reasons, but started the process of egg retrievals to start the process of IVF in early 2019. So I had my first egg retrieval, and that failed. All the eggs or the embryos degraded, and so then went through another egg retrieval where they just blasted me with drugs and made a ton of eggs, and got a handful of embryos that were genetically okay out of that round. And then I got my first embryo transfer in would have been October of 2019, and got pregnant. So was able to stay pregnant through the whole thing. It was a little bit scary because I developed a short cervix around like 17, 18 weeks of that pregnancy. So that was really scary because they basically said your cervix can dilate at any point and you lose the pregnancy. So they medically managed it, and I seemed to respond, and And so everything was fine there. And then kind of right at the end of the window where they worry about the short cervix issue, they found a possible esophageal obstruction on an ultrasound at his anatomy scan. So then I had to go to maternal fetal medicine for that. But then they said everything looked okay down there. So, and then COVID happened, and that was terrifying when you're pregnant because you just don't know what's going to happen. So it was just kind of one thing after another during that pregnancy, and I made a group decision with my team at work to step back from seeing any appointments or doing anything because we just didn't know all the unknowns of COVID at that time. So I felt very supported by them through that process. And so I had my son last year in June, and overall pretty healthy guy, had a few little heart defects, but things that we're just monitoring at this time. And then we wanted to try right away because I'm 35 now, so we wanted to try right away for another one. So I had an embryo transfer this past February that was unsuccessful, and then had a third embryo transfer in a few months later. That would have been in June. And this Wednesday I'll be 20 weeks along. So that's kind of the quick and dirty version of my story. And I've got, because my son has those couple of heart defects, they want to try to keep an eye on this fetus really closely. So I'm supposed to go to a specialist, a maternal fetal medicine specialist, in a couple weeks here for a big scan with them. And just really nervous about it because I don't want them to find anything bad. But so that's kind of the point that I'm at right now. Just lots of fertility treatments and drugs and all that kind of stuff. It's been a long road. So
congratulations though.
Yeah,
congratulations.
It's
Thank you.
exciting. So just tell me, because you haven't had a successful pregnancy yet, and you're hearing these stories about all these struggles, and how does that affect you when other people are, I mean, you said you had to go to the birth of was it your sister's baby when your baby had died? What does that do to somebody, and how do you feel when other people are talking about being pregnant or success having a child, even though it's been a struggle?
It's really interesting. I constantly feel like a terrible human being because I want to slap pregnant people.
like it's anger, like you get angry because it's not fair.
Yeah. And, when I listen to stories like, Jessica and Lindsay, who have had their struggles and they did have to put in effort and they went through similar levels of, having to work hard for it, I guess, to put it in a really kind of crude way. I don't think that upsets me nearly so much, but very recently, a very good friend of mine told me she was pregnant, and she's a friend of mine who doesn't really know if she wants babies, just her husband does, and they tried for a month, and I cried for about 3 hours. There's a big part of me that feels really guilty about having such conflicted emotions about a good friend of mine that I should really be happy for, but the more people you talk to, the more you realize that it is quite normal. My sister now has a 6-month-old who is my niece, and it's really hard I still don't feel like I've bonded with her in the way that I should. She is my first and possibly my only niece, and I should put more effort in, and I constantly feel a little bit guilty when I'm around her. But interestingly enough, when I'm around her as the baby, the emotions are quite pure. I am sad around babies, but sad is a simple emotion, and you can work through that. You can cope with a simple emotion. It's when I am around my sister, or when I am around my friend, or when I am around people who, for want of a less crude term, had it a bit easier. Those are really conflicting emotions and really difficult ones. And there's so much, and there's sadness, and there's envy, and there's resentment, and there's bitterness, and then there's guilt for feeling all of those things. And those are the ones that really hard to kind of work through, because sadness is simple and it's overwhelming sometimes, but you know what to do about sadness. But all of those conflicting emotions are really tough. And I think, and I've said this many times, the first miscarriage, you can put in the bucket of statistics. You can talk yourself through, it's okay, this has to happen to 1 in 4 people. Why shouldn't it be me? I'm no more privileged than other people. If it wasn't me, it would be someone else, And statistically, that going into a second pregnancy, you actually statistically are not any less likely to have a successful pregnancy than the first. But once you've lost your second, your statistics do go downhill quite rapidly. And so with the second loss, I had sort of I had the grief of losing the little girl that was. I had the grief that I think was probably stronger than that one individual itself. I'm not particularly spiritual. I don't sort of see the babies that I've lost as individuals or as souls. I'm not kind of that way inclined. But what really I think the grief is for is, at the moment, it's terror that what if this is my life? What if I can't have babies? What if I now, what if I go through this 8 more times like Lindsay has? Or, so a small part of the grief is that individual bub and this excitement you had and the plans you had. And I'm totally one of those people who had already picked the day I was going on maternity leave and already chosen my obstetrician. But a huge proportion of the grief is fear of what if I never get one. And then I had the third kind of grief, that my relationship with my family fell apart quite a lot at that stage. I didn't get the support that I needed and wanted. And now 6 months later, it's still kind of that way, and we're all putting in effort. But I did have a lot of grief as well associated with, being told to suck it up and get over it, and what that I felt that meant for what I thought I had in family. Turns out I don't have, and that's a whole new type of grief, to lose what the vision you thought you had of your family surrounding you and supporting you when you're a single mom. So,
is it on some level because you're trying to do it alone? Is that why they're not being supportive? I mean, I don't want to get too personal, but
no, I'm very blessed
it's
with a very liberal family. They were never not supportive of my choices.
Okay.
I did spend a number of years slowly acclimatizing the plan, so I was very
they were used to the idea
about that. But so honestly, I think it was my family doesn't do emotions well, and so after going to the hospital to meet my niece, and then the next day went and I spent 4 hours, babysitting while my sister had a nap and my mum went home to have a shower. And the following day I posted on Facebook something really silly, like, it was a bit of a joke about codependency with the dog, because I was still in bed at 2 p.m. because he wouldn't get out of bed and I was enjoying snuggles. And, basically I got a phone call from my mother saying, what's wrong with you? Like, get over it. Like, and, shouldn't you be feeling better by now? And, you should pull yourself together for your sister. This is her big time. And, stop being so angry. And literally I got a 3-day grace period where I was allowed to grieve. And I think a part of that is because with those miscarriages and the 4 weeks of, am I going to lose it? Am I not going to lose it? I leaned on people a lot during that month. So by the time I finally did lose her, everyone but me was over it. Everyone moves on because it's not their lives. And, they're sad for you, but a month of possible grief, by the time you actually get to real properly, I can grieve now because she's gone, they're done with their processing of it. And that's really difficult. And I think the same, and I'm sure You know, others would agree that things like dates that they would have been born, I get really upset on those days, partly because you're upset of those days, but actually a good, huge proportion of my upset on those days is because nobody but me has remembered.
And is that one of the hardest things about losing these babies, whether they're close like Olivia to being born or whether they're early on in the pregnancy, is part of the grief process that nobody seems to remember them? I would think that would be, like you're saying, like nobody really pays attention to the day you lost them or the day that they were supposed to be born, their due dates. They don't count them as real children in some way. Like, is that part of it?
I think it is. I mean, I don't expect people to know all the ones for our 8 losses.
But you do, I'm
because we
sure.
just had so many, but we, you know, we remember them. But I think kind of what Jess was saying, we lost a lot of people after Olivia. And what happened was, I think there were a lot of people that they don't know how to face those emotions themselves. They're scared of it. They're scared to face those emotions because maybe it rehashes something that either they went through or it just rehashes some really deep feelings that they don't want to face. The night, the day before we went in and she was gone. We went in and she was delivered on a Sunday morning, or afternoon, but we went in Sunday morning, but on Saturday we were actually at some really good friend's house. And our 2 older boys were actually going to stay the night over there. And we were having dinner with them and all these things, and it's like they were really good friends, and the next day the whole world changed. They never contacted us after that, ever.
Oh, wow.
Never, ever, ever.
Wow.
We had people who I would have considered very, very close friends, very, very much a part of my support network, that ghosted us. People who didn't want to be around us anymore acted like we were the plague. We have some neighbors a couple doors down from us even that we were really good friends with, and after that the wife would not even look at me. She wouldn't, and now to this day she won't even. She acts pissed off every time she sees me, and I haven't done anything wrong. It's just I think there must be something there that she just can't face, and instead it's easier for her to avoid me and act dismissive of me than it is to actually talk to me. And so I was really surprised. I mean, I think people in veterinary medicine were considered high achievers because we're very competitive to get into school. We always are like perfectionist mindset, you know, all this stuff. We're high achievers. And so we already as high achievers kind of don't have a big circle anyways, because our lives are very much involved in pursuing our careers and so forth. But boy, after Olivia was really, that was a whole other grief of the realization that people who you thought were supposed to be there for you were not. One of them was my best friend of 18 years. She actually was our nanny. She was actually our nanny. And so in our home 5 days a week, taking care of my older boys. There was no emotion from her. No emotion. It was the oddest thing. And over the course of the next 3 months, maybe 4 months, she got really weird. She got really, someone who was my best friend since high school didn't want to talk to me about it. She was really dismissive of everything. She really avoided me even in my own home. And it culminated in her doing some very strange things, being very abusive towards our boys. Because she didn't know how to deal with the emotions, and we had to fire her. And I've never spoken with her since.
People say things like it's uncomfortable to talk to you, or it's awkward, or people don't know what to say to you. And I do understand that. I haven't been easy to be around, you know, I am low, and one of the challenges I face is that I want to talk about my babies and other people don't, because they don't know how to. And so then I get grumpy at them for not, but you know, so I will 100% admit that I am not the easiest person to be around. But there's a part of me that when someone says, oh, I don't know what to say to you, or this is uncomfortable, I just want to strangle them. You think this is uncomfortable for you?
Right.
You think you are the victim here, or that this is hard on you? Like, just man the fuck up. Sorry, I don't know if I'm allowed to swear on your podcast.
Well, I guess you are now, because you just did. I think that you deserve it.
There is a lot of anger at people who I don't dismiss the fact that it's uncomfortable, but you have to sit with that. And the only way you can really be there for someone properly is being willing to sit through the worst of it, and not try to cheer them up, and not try to distract them. People are grieving, and you know, my mom said to me, you know, when do you think you're going to feel better? I don't want to feel better yet. I need to sit in this misery, because, you know, grief at the end of the day is how you express love, and I don't want to not feel this, because that's not fair, and that's not honoring. And, you know, even unlike Olivia, which is just a beautiful name, mine didn't have names yet, but my fetuses did, because of course, you know, I'd seen them when they were 8 cells large, and I had nicknamed all of my little embryo babies, as we call them. And so my first one was called Blob, and my second one was called Squishy. And they sound silly and they sound ridiculous, and it's weird to say them, you know, out of context. But when I was pregnant, my little Squishy was such a term of endearment, and now I can't say the words out loud because no one else will. I can't, my family will not, you know, use the terms, they won't talk about. Even like, you know, my dad, who of my family members is actually emotionally competent, you know, he wants, and he tries really hard, and he wants to, but he says things like, oh, I know there's a difficult day for you coming up. Like, and that's the best he can do. He can't say
the words
due this week. He can't, he for him, it's just impossible. All he can do is his absolute best, which is acknowledge that I'm going through a tough time. So I think some of those things where people try to help you or avoid you, or say things like "at least." Any advice for anyone out there who does?
Don't say that.
If the sentence starts with "at least," don't say it. At least you know you can get pregnant. At least you lost them early. At least. Don't say it. If it starts with "at least," it's going to upset us. It's the most unhelpful thing.
What can they say, Jessica? Like, what? I know, don't say this, say this. Like, what helps? Or, I mean, I guess it can't help. Maybe that's a silly question.
I don't know specifically things that they could say in those situations, but I've heard many of those same comments, like at least it was early on. There's probably something really wrong, and had it gone full term, you know, that would have been really bad, or something like that. I've got a lot of those comments. Don't make me feel better. But the people that helped me the most were the people that, like you guys said, just sat with me through that grief and that pain, and just didn't try to make me feel better, and was like, wow, this really blows. And just, yeah, that was, I think, the most helpful thing. I had a few key people, my parents and some close friends, and my husband was really supportive too. Just that was the most helpful thing for me, just people that sat with me in the grief and didn't try to make me feel better, because nothing that anybody said made me feel better at all. So
I think one of the things that has always touched me is when we went back to the hospital to have, every time we would go to labor and delivery triage with the twins, I would catch nurses with the little rose pin on.
Oh, that's nice.
People who had been there with Olivia, that we gave them those rose pins and that they still wore them. They still, and they knew the story and they would tell people about my Olivia. And like you said, she made an impact, and that's all I could ask for, you know. That's all you can ask for. And we'll have people, so I mean, for the things that people don't say, you know, at least you got to see her on those ultrasounds, at least you got to spend time with her after she was born. Maybe it's not meant to be.
Oh God.
Maybe
That's the worst.
It's the worst.
Like there's some purpose or something. That's always a cliche,
Right.
that there was a purpose in this.
Not helpful at all. We do need to go through the grieving process. We do need to move through the stages of grief at our own pace. For some people, it happens rapidly. For some people, it doesn't. Some people get stuck in certain phases of it, and they need a support system that will help them move on to the next phase without making those comments. And I think one of the biggest things is just making this not a cliche, like a taboo. People think it's so taboo to talk about infertility or loss. And for us, at least, I tell every single person on my team, every single person that I've hired, because after my daughter died, we changed so much about the clinic. I weeded out so many people that I was like, you know what? You're a leaner. You're not a lifter. And because you're a leaner, all of that fell on my shoulders. And I know that played a role in me losing my daughter. And I only want a team of lifters where we lift everybody up. Everybody lifts each other up. So you're either with me or you're a leaner and you need to go. And I cut out like half my team. And then every time I hired someone, when I interviewed them, I told them the story about Olivia and the impact that she had on me, and how she was changing my form of leadership, and how we were going to practice needs-based leadership, because everybody has their own needs. And I want to make sure we help them meet their needs so that they can be lifters and they don't have to go through that awful, isolating feeling of whatever they're going through in their lives. And after that, when we made it not a taboo thing to talk about, my entire team will talk about Olivia. If you ask anybody on my team, who's Olivia? You know, they all know.
It's so great that you've managed to create that culture of safeness for people to talk both about Olivia, but I'm sure that also has flow-on effects for them and things that they maybe are struggling with in their own lives, or anybody that in the future had struggles with fertility or loss. And I totally agree with you that, you know, there's this thing about you're not supposed to tell people until 12 weeks. And I started off my pregnancy, you know, naive. I think about the me that was before babies and the me that is now, the naive me. You know, I had this really strong philosophy that not talking about pregnancies until 12 weeks was anti-feminist. I think that, you know, as long as you make it this women's problem behind closed doors where people, you know, don't feel like they can tell people in case it's awkward when they have to tell people later that they lost it, like in case it makes other people uncomfortable if it doesn't stick, or, you know, and obviously in the workplace, you know, because you don't want your employer to have thoughts that you might want to have a baby soon. And so the feminist part of me had a big problem with this. And I really, and so as soon as I got pregnant, you know, obviously I knew very early because I knew exactly when I was implanted. So, you know, literally knew 14 days after transfer. And I told people happily, openly, really kind of excitedly, because I believed that they could then be there for me if something didn't go right. They'd seen the excited parts so they could, to some degree, understand the lower parts. But to be honest, having lost 2 now, I don't know if I get pregnant again, I will tell people about it, because the awkwardness with which I've largely been met, and the, I don't know what to say about that, so I'm either going to change the topic or, give some really unhelpful platitude.
Which is so
I
sad. So you can definitely message me and tell me.
thank you.
Yeah, all of us. You can let
All
us
of
all
us.
know. Because when I first met you, Jess, I think our first podcast, was it our first one you were pregnant? And then the second one we did, you had lost, was it Squishy that you lost?
Yeah.
And yeah, that was something you were going through when I met you.
Yeah. And I think, jumping back one conversation, what are the things that people can do to help, and I agree, nothing you do helps, but there are things you can do that doesn't make it worse.
Okay, well, let's hear that. For people like me that, that haven't been through this, what can we do? What can we say? How can we support?
For me, the absolute biggest one was people would genuinely say things like, let me know if there's anything I can do. And I was in the headspace of both, I can't even think. Decision-making is not something I can fathom right now. But also, I'm a very independent person who asking for help doesn't come very naturally to. But let alone what I really actually needed was healthy food. Like I was overeating it every night. A couple of people bought me chocolates and cookies and things, but actually I needed a real food group. I needed some salads and some roasted vegetables. But that's a weird thing to turn around to somebody who's, patting you on the back and kind of, you aren't sure if they're offering you a platitude when they say, let me know if there's anything I can do. So my biggest suggestion to anybody, and I don't know that this just applies to losses of babies, but possibly grief more broadly, is just do something. Just bring them some home cooked meal. Just turn up to walk the dog for them, or get them a house cleaner. Or, I think the less they need to think or feel that they're asking for your help, or they have to come up with a way for you to help. Like it puts a weird, strange pressure on you to feel like your job is to help other people feel better, because that other people feel better about it and less awkward if they can help. And so you want to offer them a way to support you. But it feels unfair that you have to make them feel better too. So I honestly, if I could say one thing, two things, it's home cooked healthy food and just do something. Don't, ask their permission, in the way, but don't do it in a, what would you like? Do it in a, I'm going to come around at 5 to walk the dog. Is that okay? This is how I would like to help you. I would say for me, it was the most useful thing out of anything. And as with Lindsay and Jessica, people who just are willing to just sit with you in it. Don't,
And be sad, right? Just sit and be sad alongside you.
Feel better. Don't try to tell you it will be okay. Don't try to cheer you up. If it really comes to it, trashy ass movies, and just sit with me and be in the room while I'm freaking miserable, so that I know that you're not tempted to avoid me, basically.
I think that when people don't do those things and they avoid us, it makes you feel very unworthy.
Yeah.
That you're not valuable, that you're not worthy of their love, of them caring about you. And so, after Olivia died, I was in the same mode that Jess was talking about. People would say, what can I do to help? And it was like, I don't even know if I took a shower today. There's no way I would be able to tell you how to help me. And thankfully there was a big group of veterinarian moms who got together. They got a meal train going. My kids would not have eaten if they didn't do that. I wouldn't have eaten. We had sometimes people would sign up for it that I didn't even know. Other vet moms in the area that I didn't know, other vet moms from other states who sent who would send food like DoorDash. And I live like out in the boonies, like most people don't deliver out here. And they would somehow find a way to get food to us. Sometimes they would come drop it on our front porch with a little note just saying, I'm just thinking about you. They would send us books about grief. On the 1-year anniversary, one of our reps got me pink Olivia roses, because there's such a thing, I guess, as an Olivia rose. And she got us a big, huge bouquet of pink roses with little pink angel. People just saying, you know, we're here, we care about you. We don't expect anything in return. We just want you to know that we're here. And I mean, those meals meant so much to me. Those little cards meant so much. I still have all of them. They mean a lot. They mean a lot to me. Or people randomly saying, you know, I remember your story. And I know somebody acknowledging. I know someone who was having some weird symptoms in their 3rd trimester. I told them to go in, and they rushed into a C-section, and baby's fine now. But, you know, people just like spreading the word, you know, and it's like, thank you for coming back and telling me. Thank you for coming back and telling me that by me putting myself out there, as emotional as it is and as hard as it is, thank you for coming back and telling me that it's making a difference. So that also, I think, has helped me move through some of the stages of grief, is that, you know, she's not coming back. She's not coming back, but, you know, we can help other people. So I think those are the little things. And it might seem silly. Someone coordinated for me to get cards like even 6 months later, you know, because the initial few weeks, everyone is involved. Everyone wants to help. It's so
The hard
raw.
thing about grief is people kind of forget and move on, and you're still in it.
Except you.
Right.
And I agree with you, Lindsay, that sometimes the little things are the biggest things. I think, I was talking to somebody quite recently about one of the things that I appreciated most. There were 2 or 3 friends that I have that are overseas that sent me messages that said things like, just checking in, don't expect a reply, just want you to know I love you. You know, like, so you didn't feel like, you know, if you weren't ready to talk or if you weren't wanting to engage with the world yet, you didn't feel any obligation to, because a lot of people do want to help and they want to reach out. But you kind of feel obligated to respond and say thank you. And so I think those people that can either just reach out going, no response necessary, I'm here whenever you're ready, if that's next week or next year, that those messages meant a lot to me. And I think that that's something that people could consider, just knowing that the person may not be ready to talk to you. Even if yesterday they talked to you, today they might be having a terrible day. And just letting them know that you're still there, not, you know, and that, the 6 months later mark, you're still there, not, you know, you don't think that it's all over now just because your day-to-day carries on. But honestly, what somebody could do for me now, and, you know, I say this nostalgically with knowledge that it's not going to happen, would be for somebody to ring me on Squishy's due date and say that they remembered that. And those are the things that if I ever have a friend or family member who's going through something similar, the day it happens, I would put it in my diary for the next year and the following year, so that I know to reach out to them on a day that's going to be lonely for them.
That's really good advice for people, because I think people feel awkward about those kind of things. And for you to say that that's okay to acknowledge it and remember, you know, like you want them to remember Olivia, you want them to remember Squishy, you know, these were your children. And I think not everybody thinks of it that way. And I think that might be part of the pain, the added grief, that people don't acknowledge that these were your children and are your children.
Yeah, and I think what feels right for one person may not be the same. You know, all three of us here have very different stories of loss and grief and struggle. And so perhaps there are people out there who wouldn't appreciate that as much. But I know for me personally, you know, that knowledge that other people have remembered is probably one of the most valuable things for my soul.
You know, I was gonna.
Oh, sorry, go ahead.
No, it's okay. I've been chatting too much. You go ahead.
Oh, no,
Jessica.
no worries. One of the things I was going to add, just that helped me through the process, I kind of created my own little memorial garden because I live out in the boonies as well. And so I have a yard and we can make a garden. And like my mom and several of my friends from work who are all moms had gotten me some plants, perennials. And so these are things that I still look at to this day. And can look at and remember those pregnancies. I don't even myself, I don't even know if I remember the due dates. I remember when I lost them. And so I don't know if for me, that's something that I want to rehash every year, but I really love that I have something I can look at in the nicer months that just bring back those good memories. And with a little angel statue out there, that's something that's been comforting for me, at least. Plants. So
that's a good one. Yeah, I planted a jacaranda tree as well. The other one I struggled, I lost Blob at the beginning of December, and Christmas was challenging for me because I didn't feel like I should or could be cheerful and do Christmas caroly things, let alone put a tree up in my house. And, you know, I had a little fake tree that used to come out every year. And, you know, by the 23rd of December, I hadn't put it up because I didn't feel in any way like it felt right to celebrate something that's quite a family oriented kind of thing when I no longer had this family, I guess. But a friend of mine suggested and, you know, sent me a link. It was a Christmas bauble, really beautiful kind of glass ornament with a feather inside it. And, you know, an inscription that was, you know, I carried you for every second of your life and I'll love you for every second of mine. And somehow having that hung on the tree made it okay. Like, and I think about future Christmases where hopefully I might have kids and presents under a tree for a future child. I think that those small reminders that don't have to be sad, hopefully forever, but you know, are still an acknowledgement that you were meant to be a part of this family, and I'm not going to pretend that that's not true forever. So, you know, this year for Christmas, I'll have something similar made for Squishy. And I think just those things they don't have to be in your face, because I don't know about everybody, but I certainly don't want to see reminders all of the time. But I think those moments that are particularly special or particularly could be painful, making sure that people don't ignore it around you. And, you know, I think having, whether it's a tree ornament or a plant, and that you can actually say to people, you know, that's my memorial for. I think that that's quite important.
That's,
go ahead, Lindsay.
The first Christmas, I was the same. We lost her right before Halloween, and my kids wanted to go trick-or-treating, and I was like, can I just dress in all black? What do you want me to do? My in-laws invited us over, and I just sat on the couch because I had a C-section. So I was still recovering from surgery. And I just sat on the couch, and someone came to the door from across the street that had just had a baby the day before. And it was so hard. I mean, I was a black cloud, you know, I didn't want to do anything. And then Christmas came around, and the only reason that I put up the tree was because of my kids. I didn't want to at all, but they wanted to, and they really pushed me. I had gotten some stockings, and they really pushed me to get a stocking for Olivia. And so I did, and So every year we all write letters to her and we put them in the stocking about, the things we wanted to do. He's now 10, my second son. He took it really hard when she died. He would have dreams about her. He said she would come visit him in his dreams all the time. And he would say things like, I was supposed to pick out your bows and your dresses and your pretty shoes, and I was going to do that for you. And it's so sad to read his letters to her. Um, but we started doing that, and it's been so therapeutic, I think, to write those letters to her, to write those letters and show her that, we all still remember you. You're such a big part of all of our lives. And we actually had some friends who said, can we write letters too? It's just been amazing. And so now Christmas has always been my favorite holiday, but of course that year I was like, no, not doing it. And it almost took that holiday away from me for a long time. But now I can find joy in it again, because we all gather around and write these letters to Olivia. And I'm just so glad that someone recommended that, because I would never have thought of that.
It's a nice idea.
So is there any advice that you would give someone like Jess, who is in the middle of this? Jessica is also in the middle of this. You went through it so many times, Lindsay. Like, is there some kind of advice that you could give someone that's struggling with any of this infertility, loss, all these issues now, that you can share that you've learned for yourself? And then how do you move forward? Like, how do you keep trying?
My story is just so different. I kept trying because I had that dream.
Yeah.
Someone told me I was going to have boy-girl twins. I saw them. I saw myself. I remember being really young and telling my grandma about the dream. And she said, I had a twin brother and he died when we were 5 from leukemia, but I had a twin brother, and so they run in our family. And I remember telling her, I hope I don't look like that when I'm older, because I had seen myself and I had seen, my 2 twins. So for me, I knew that I needed to keep going, because something just kept telling me that was the light at the end of the tunnel for me. But if I didn't have that, because there were definitely times that I questioned it, like, this isn't going to work. There's 8 miscarriages and no one's helping, and the medications aren't helping. So my advice would be to either find your anchor, find something that brings you hope, that brings you joy, that you can hold on to, because it is a long journey and it is a roller coaster. Making sure you meet your other needs in your life. As high achievers, we don't meet all of our needs. We're very depleted, which leads to a lot of bad things, as I learned the hard way. Getting involved in other things that you find that you're passionate about or that make you feel purposeful. I mean, those are the things that really help me to continue down the journey and find hope and joy in things. But it was hard. It was so hard. It was so hard because I had employees who had one night stands and got pregnant. And it was really hard. So there's nothing I think that can help people through that part, except to just understand you got to face it head on. You just have to face it. You have to find something that you can latch on to that's your little sliver of hope and joy to get through it. I hate to admit it, but my older boys were not my my hope that helped get me through. I was at that point felt like maybe I wasn't supposed to be a mom. I had a lot of really dark thoughts, a lot of really, really dark times after Olivia. But you just have to keep going through. You have to just understand that there is a light at the end of the tunnel somewhere. And for people that have that drive and that passion to be a mom, to be a parent, it's in you for a reason, and you just have to keep pursuing it. And it's just what I tell people. I have a friend who's going through the same thing you are, Jess. Single mom by choice, going through fertility treatment. And I just keep telling her, just, it's okay. I'll be your support. It's okay. It's going to be a roller coaster. Might not work initially. You just keep trying. And when you have a bad day, just let me know. And I periodically just send her messages, and that's all you can do. That's all you can do.
I think those support networks are an interesting one, because I think naive me, pre-pregnancy me, would have said things like, I've got a family I can depend on, and the support networks that I thought were there are often a little bit surprising. And don't get me wrong, I have a best friend since vet school who lived in a different state to me, literally the other side of the country. And when I lost Squishy, she was at my house before my mum was. It took her 2 hours to be on a plane. And I think moments like that, you really know who your support networks are. So I think it's interesting, because I would have said to people, make sure you lean on your support, but it's interesting that you don't actually necessarily know who they're going to be until it's happened. So have a wide enough network that you've got some backup plans.
I think people just need to accept the help too. And sometimes it is really odd things. Sometimes it really is. And you really want to say, is that how you show you care? That's odd. And you just need to understand that they don't know how to do it. They don't even, there were so many people we encountered that were like, we don't even know how to help you. We would just be devastated if we were in your shoes. But here is a random gift card that you can use at any time, and it was fine. That was their way of saying
came from a place of love, right?
Exactly.
I think one of the most thoughtful things that anybody did for me, again, very, very excellent best friend, is that after the second loss, I had a huge bleed after the D&C, and it was, I don't want to overshare, but it was a massacre in my room basically, and there was just blood everywhere, and I couldn't escape it. And it was 3 o'clock in the morning when I phoned my best friend, and luckily the time difference meant that it wasn't as bad as it sounds. But I slept in a bed covered in blood because I couldn't cope with it. I just couldn't bring myself to do something as arbitrary as clean the goddamn sheets. And in the morning, by the time I woke up, she'd sent me the details. She'd already booked me a cleaner to come to my house. She'd ordered some Kmart new sheets to be delivered that afternoon, and had paid for a fancy hotel in the city for me to stay at for the night, so that I didn't have to go back to my room. Like, those are the things where someone's really thought through, what is she saying? What is she struggling with? What is hurting right now? How can I solve today's problem? I know I can't fix this for her, but what's her problem today, and what can't she do for herself? How can I solve that? And that's how people really love you.
Yeah.
But I also agree with Lindsay that sometimes just the randomest things that people really thought, I don't know what to do, but I want you to know I love you, that's meaningful too.
Well, I appreciate this so much. Is there more that we can say? Is there a last little bit of something we missed?
Yeah, I just wanted to say that I know you had kind of posed one of the questions before about how almost like in the veterinary field in particular, how can we help? How can we address this? Because it is very rampant. They all come out of the woodwork. As soon as you say that you've gone through this, as soon as you say and you open up and you're honest, could not believe the people that I had known for years. I never knew they'd lost a child. Never, never, never. They come out of the woodwork. And what I realized is that in our profession, it happens a lot. It doesn't mean that it happens probably more than others, but it's just like amazes me. And one of the things I was telling people is one of the things that I changed after Olivia is setting boundaries for myself and making sure that my team was okay, that I only surrounded myself with a team that was okay, that I was setting boundaries for myself, and okay that I was allowing them to also set boundaries for themselves for what they needed. And that building a network around you of people that are okay with you setting those boundaries, okay with you saying, everybody knows, October 22nd, don't contact me. Don't contact me unless you're sending me something that's a pink rose, or you're just saying, I'm just thinking about you today. And it's nice. I think in veterinary medicine in general, we need to be okay with setting those boundaries, and we need all of our teams to understand that we have boundaries, and that on those days that we're really struggling, maybe we do need some space, and we need them to not make us feel guilty about it. If we're saying, I'm feeling overwhelmed, because sometimes those waves do come at odd times.
Definitely.
It doesn't have to be a holiday. It doesn't have to be her anniversary. It doesn't have to be anything. I mean, I might just get this wave. My first day back, this is the irony, my first day back in the office after Olivia, my first two patients, one was a cat named Olivia. I had never seen a patient named Olivia. Never. A cat named Olivia. And the second room was a newborn baby girl. I mean, talk about being tested. I walked out of those rooms. I had to excuse myself from the room with the newborn. I told them what had happened. I started bawling, and I had to leave. And my team stepped in and they finished the appointment, and they gave me that room, that space to like go take a time out in my office for a couple hours. I think they bought me some cookies and slid them. Here's this. But just knowing that they were okay with me having that boundary, they were okay with me saying I needed to take that time for myself. They were okay with me saying on those days that I would have a really bad day, they were okay with me saying, hey, I got to go get myself right before I can come back and be effective. That has been the single thing that has allowed me to stay in this profession. My daughter died in my clinic because of me being there at my clinic. I wanted to sell the place. I wanted to get out of the field. I wanted to never do this again. But the only reason that I'm still here, the only reason I'm still a practice owner and still go into my clinic, stand at the treatment island where she died, is because I have a team around me that understands I have boundaries and understands that it's okay for me to do that. I think that's a huge thing for veterinary medicine that we need to be okay with.
Well, and I feel so blessed and honored that Dr. Jessica Moore-Jones talked about this to me and volunteered to discuss this on this podcast in order to help others and realize that this is something that we need to talk about and that we need to support each other in. So it's not a secret and it's not a surprise, and that we know that, we're all women in this profession, and these are things that, we go through. And I'm just really, really feel blessed that the three of you are willing to talk about all this, because it's hard, and I'm going to cry, but yeah, it's.
Well, I think it's really great that you're doing this.
Yeah.
I mean, I think that's great. We don't, like I said, it's taboo.
Yeah.
In our
I think
culture.
that's where, so the Lindsays focus on it being okay to talk about and it being okay to not be okay, you know, is sort of, I guess, you know, so very tragic, because, you know, Olivia was so close, and you know, I think possibly a lot of your team are able to kind of conceptualize Olivia as a little baby girl, whereas I think sometimes when you're losing them quite early, people, because it's this, oh, it was just first trimester, like it wasn't a person yet. And I think if I would love to see any sort of changes come about by us being able to talk so much about it and be open and allow people to know that other people are going through this, and that even the people here have had 3 totally different experiences, but they're all equally difficult and tragic in their own ways. I would like us to start talking about it. You know, people to hopefully start to feel comfortable talking about their pregnancy when they're pregnant, so that this loss in the first trimester isn't belittled. It's not, oh, well, it was only a first trimester loss. And don't get me wrong, I want to be really clear, Lindsay, that I cannot even fathom going through all of that and getting so far and losing them then. And you know, I don't think that there's a spectrum of grief, but if there is, you definitely, you know, are, it's a whole different level of tragedy. But I guess my experiences have been just that little bit more that people tend to, because there's this taboo about talking about it before 12 weeks, if you have talked about it, or if you do lose them within that 12 weeks, it's kind of considered, oh, well, you know, at least it was first trimester. And I think I would love people to feel more comfortable in the future talking about their pregnancy as soon as they're pregnant, so that people can see how excited you were, and that this baby meant so much to you, and that you've planned your life for the next 20 years now. And so if and when those things don't work out, people see how much it meant to you, because your baby was your baby, not on some unknown, it's only first trimester. And that would be my big thing. I'd really like it to be just talked about early enough that people know that your baby meant something to you.
And I think employers, I mean, as an employer, I will tell you, when I even have an inkling that one of my employees is pregnant, I am immediately like, look, I want to protect you. Okay, let me help you, please. You know, but I know so many people are like scared to, like, they don't want to say anything. They don't want to even, oh, I can't take an x-ray, because they're worried their employer is going to already have those bad thoughts, like, oh my gosh, I'm going to lose them. They're not going to come back after maternity leave, or, oh, this is such a hassle. It's like, I don't know why we have to think that way. You know, this is a joyful time. This is such a joyful time for any woman, and I mean, and their spouse, if they're married, or what, you know, whatever, or significant other, or even if not, like with Jess, like it should be such a happy time, and we shouldn't be downplaying that. So I would really, really love the culture to change, like Jess said, that you can talk about this. You can share your joy with people around you, because by sharing your joy with them, like you said, if and when something does happen, they shared in that joy with you, they feel some of the grief, they're going to be more supportive of you.
Oh,
That's
true. I mean, that's really true. That you can share in the joy of the pregnancy, and then share in the grief of the loss.
Yeah.
Well, I appreciate you all so much. And I hope that if anybody's out there that's struggling with any of these issues, and please reach out to me, and I will get you in touch with one of these ladies and ask questions. We're here.
Absolutely.
100%.
We're rooting for all the babies to come. We're rooting for Jess's baby to come, and Jessica's baby to come, and we're rooting for them and praying for them.
Thanks. Baby dust, as they say.
Yeah,
yeah.
They're out there. All right, I appreciate all of you. Anything else? Any last words before we wrap it up?
No.
So
Thanks for hosting us, Julie.
Jessica and Lindsay, I'm just honored to be here with you.
Thanks for hosting us.
Yeah, thank you so much for being here. All right, goodbye, everybody. Bye.
Bye.
Bye. Thank you.
Thank you guys so much.